It's me, Richard. I may look tired. It's because I am. Been working a lot, but I just gotta get this done. I've been in this ABG lab for a couple hours now. I'm at work. Yeah. Anyways, so I'm doing the endocrine disorder chapter, which is chapter 11 in our book. Um, so let's start. So we're going to start with diabetes mellitus. It's the most common endocrine disorder. It affects 23.6 million children and adults in the United States, which happens to be 7.8% of the population. 18.9 million are diagnosed, while 5.7 million are believed to be undiagnosed. And about 57 million people are pre-diabetic. Who would have known? So diabetes mellitus is a condition in which the pancreas does not produce sufficient amounts of insulin to meet the body's metabolic needs or the peripheral tissues, where insulin does its work, have become insensitive to insulin's effects. Some other facts: diabetes mellitus may present with acute onset of ketoacidosis, which may lead to coma or even death. There are four main classifications of diabetes mellitus, but broadly they're classified as type 1 and type 2. But the terms insulin dependent and non-insulin dependent used to describe type 1 and type 2 are now obsolete due to type 2 diabetes eventually needing insulin to treat the disease. So type 1 diabetes mellitus is autoimmune or idiopathic destruction of pancreatic beta cells and results in insulin deficiency, usually before the age of 30. So type 2 diabetes mellitus results in a spectrum of insulin resistance, impaired insulin secretion, and increased glucose production that historically developed in adulthood, but in recent years has developed in obese children and adolescents. It's generally caused by genetics, lifestyle choices, and environmental factors. Also, insulin resistance is a condition of defective insulin activity within the insulin-dependent tissues, primarily the liver, muscles, and fat tissue. So some signs, symptoms, and diagnosis facts for diabetes mellitus. Classic symptoms are polyphagia, polydipsia, and polyuria. Hallmark of diabetes mellitus is hyperglycemia. Not unusual for those with type 2 diabetes mellitus to be asymptomatic. Typically means persistent, long-standing state of hyperglycemia. Maybe they've had this disorder for about 5 to 7 years. Some symptoms they could have are blurred vision, fatigue, flu-like symptoms, abdominal pain, nausea and vomiting, vertigo and dizziness. Type 1 diabetes may present with more acute symptoms such as unexplained weight loss with increased appetite and caloric intake, but they also get fatigue, irritability, blurred vision, infection, dehydration, abdominal pain, and coma. So, diabetes mellitus is the 5th leading cause of death in the U.S. in 2007. For management, studies show that controlled blood sugars diminishes the complications of diabetes mellitus. The goal of therapy is to improve the A1C level to as close as normal, which is about 4 to 6%. And for every percent point drop in A1C, the risk of microvascular complications decreased by 40%. Type 1 diabetes mellitus require insulin replacement therapies. Some are good candidates for insulin pumps, but at the same time, it's important to avoid hypoglycemia, which can have immediate long-term effect. There are both oral and insulin replacements to help control type 2 diabetes when lifestyle modifications are not enough. So guys, I just got paged. I have to go back to work, but thankfully I have some friends that are going to help me with this presentation, so sit back, okay?
Hi guys, my name's Cleo, and I'm gonna talk about hyperthyroidism. Here's some general characteristics. So thyroid disease is the second most common endocrine disorder, more common in women than men. It's common in smokers. Thyroid gland main function is to regulate the body's metabolism. Thyroid is regulated by TSH, which is thyroid stimulating hormone, which is secreted by the pituitary gland. Hyperthyrotoxicosis is the broad term given to describe the state of increased levels of thyroid hormone without specifying the source causing the excess. Hyperthyroidism specifically implies that the cause of the excess is directly from the thyroid gland. Graves' disease is the most common form of thyrotoxicosis. It's 80% of its cases in the US and happens in 0.5% of the population. Most common in women between 20 to 40 years, but it can occur at any age. Autoimmune disorder resulting from thyroidotropin, thyroid stimulating hemoglobin, TSI, which stimulates thyroid gland growth and excessive thyroid hormone production. 10% of patients with Graves' disease present with ocular abnormalities. Precipitating predisposing risk factors for developing Graves' disease include infection, stress, smoking, genetic susceptibility, pregnancy, and certain medications. Thyrotoxicosis is a hypermetabolic state. It leads to an imbalance of energy metabolism where energy production is abnormally increased and exceeds energy usage. Thyrotoxicosis and the thyroid affect every organ system, so signs and symptoms are profound. Some of the signs and symptoms are anxiety, insomnia, fatigue, weight loss, heat intolerance, low-grade fevers, dry skin, hair thinning, conjunctivitis, muscle dysfunction, blurry vision, palpitations, chest pain, hypertension in the systolic, CHF, afibrillation, shortness of breath, diarrhea, increased appetite, tremors, muscle weakness, coma, stupor, decreased libido, and fertility, just to name a few. So for management, medical therapy, supportive therapy, radioactive therapy, and surgery are general options. In appropriate cases, antithyroid drugs are used. Thiamines are most common and are broken into two classes, thiouracils and imidazoles. Both decrease the production of thyroid hormone and have an inhibitory effect on the immune system. The FDA has published that thiouracils not be used as a first-line drug therapy due to related liver failure. But there are 3 instances that is preferred. Pregnant women, in first trimester, life-threatening thyrotoxicosis, and patients with adverse reactions to imidazoles that aren't candidates for surgery for radioiodine. Beta blockers are used primarily for controlling symptoms during early management. 2 types of definitive therapies are surgery and radioiodine. Radioiodine, most widely used therapy for hyperthyroidism, was introduced in 1940s. It is considered safe, effective, and relatively inexpensive. Surgery is oldest, but has 2 worrisome complications, which are permanent damage to the laryngeal nerve and hypoparathyroidism.
Hey guys, hope you had a good time with Cleo. Sorry I had to leave. I got paged. I had to do something, so here we go. So we're going to move over to primary hyperparathyroidism, which is a disorder of the parathyroid glands. Most cases are caused by one or more enlarged overactive parathyroid glands secreting too much PTH, which is parathyroid hormone. PTH maintains the correct balance of calcium and phosphorus in the body. It regulates the level of calcium in the blood, release of calcium from the bone, absorption of calcium in the intestine, and excretion of calcium in the urine. When the parathyroid glands secrete too much hormone, it causes hypercalcemia and may be the first sign of hyperthyroidism. 85% of people with hyperthyroidism, a benign tumor called an adenoma has formed on one of the parathyroid glands and causing it to become overactive. Hyperthyroidism occurs in 100,000 people in the U.S. annually. It affects women more than men, about 2-to-1 ratio, and the risk increases with age. In women 60 years and older, 2 out of 1,000 women will develop this disease each year. So some signs and symptoms, and for diagnosis, 50% of patients are asymptomatic. When symptoms appear, they tend to be mildly nonspecific. It could be weakness, fatigue, depression, And in more severe cases, they may have a loss of appetite, nausea, vomiting, constipation, confusion, impaired thinking or memory, and polydipsia and polyuria. And if you're looking at an EKG, the QT interval actually gets shortened. And some ways to manage it, surgery usually to remove enlarged gland or glands is the main treatment and is curative in 95% of the cases. Um, Calcimimetics are a new class of drug that stops the secretion of PTH but are used for hyperparathyroidism secondary to kidney failure with dialysis and parathyroid cancer. This has not been approved for primary hyperparathyroidism though. Well, since I've been so busy with work and other stuff, I've actually have two friends that are here to help me do my presentation. So, listen up. Hey guys, I'm here to help out Richard because he is awesome. I am Spider-Man, by the way. So I'm here to help him with primary hypoparathyroidism. This is a disorder of the parathyroid glands and in most cases caused by surgery performed to correct an overactive gland. Incidence is rare, 4 out of 100,000 people. There are some forms of the disease caused by congenital and familial abnormalities, described as Wilson's disease and hemochromatosis. Parathyroid glands do not secrete enough PTH and causes hypocalcemia. Most common symptoms are dental changes, cataracts, basal ganglia calcification, extrapyramidal disorders due to chronic hypocalcemia. Acute hypocalcemia symptoms of tetany, papilledema, and seizures may occur. Tetany can range from mild to severe. Diagnosis is made by laboratory tests. For management, hypoparathyroidism is usually correctable with replacement therapy. Some complications such as basal ganglion calcifications are irreversible. Most require lifelong calcium and vitamin D supplements. Thank you, Spider-Man, for the help. Thank you, Spider-Man, for the help with the presentation. So we're going to move on to Cushing's disease, which is an adrenal gland disorder. And the adrenal gland disorder actually secretes 3 classes of steroid hormones: androgens, mineralocorticoids, and glucocorticoids. Cushing's disease is an excess of glucocorticoids, and the term Cushing syndrome can be used to refer to a clinical presentation that involves this following symptoms: weakness, facial plethora, susceptibility to bruising, weight gain, blood loss, insomnia, glucose intolerance, menstrual irregularities, impotency, bone loss, hypertension, and ankle edema. Common cause of Cushing syndrome is iatrogenic from medically prescribed corticosteroids. It has been reserved for cases that have been determined to be caused by the pituitary producing excess adrenocorticotropic hormones. It was first described in 1912 by Dr. Harvey Cushing, so that's where it got its name. Other causes are polycystic ovary syndrome, ovarian tumors, congenital adrenal hyperplasia, obesity, excessive alcohol consumption, family tendency to have round face and abdomen, with hypertension and hyperglycemia. It usually presents after puberty with equal occurrence in males and females, and in adults, frequency is higher in women than it is in males. So 4 features that are most suggestive of Cushing's disease are facial plethora, muscle weakness, and proximal myopathy and atrophy. Susceptibility to bruising and abdominal red-purple striae that are greater than 1 centimeter wide. Diagnosis has about 3 steps. It has to be suspected on basis of symptoms and signs. Presence of excessive endogenous cortisol must be documented. The urine-free cortisol, late-night salivary cortisol, and 1 milligram overnight dexamethasone suppression test. Determine what is causing the excess cortisol, basically. So management depends what is causing the problem. Either it's the adrenal glands, pituitary glands, or something else in the body. Treatment can be surgery, radiation, chemo, or use of cortisol inhibiting drugs. Pituitary Cushing's disease is best treated by removal of tumor or removal of the entire pituitary gland. So to introduce Addison's disease, I figured it would be better if Cleo did it than me, because I'm sure you're tired of seeing my face and hearing my voice.
Hey guys, it's me Cleo, and I'm going to talk about Addison's disease, which is deficiencies of glucocorticoid hormones, referred to as adrenocortical hypofunction, chronic adrenocortical insufficiency, or primary adrenal insufficiency. Addison's disease can start at any age and affects males and females equally. It's relatively uncommon. 70% of cases caused by autoimmune process that results in the destruction of the adrenal glands causes Addison's disease. Aldosterone is the major mineralocorticoid secreted by the adrenal glands and serves to promote sodium reabsorption and potassium excretion in the renal tubule. Aldosterone is stimulated by hypovolemia. Cortisol is the major glucocorticoid secreted by adrenal gland. Purpose is to maintain vascular tone and counteract the effects of insulin and assist in inhibition of protein synthesis in muscles. 30% of cases of Addison's adrenal glands are destroyed by cancer, infections such as TB or other diseases. Genetic abnormalities may cause Addison's disease as well. Soon after developing Addison's disease, symptoms of weakness, fatigue, and lightheadedness upon standing after sitting or laying may be exhibited. Problems happen gradually and insidiously. Patches of dark skin that may have seemed like tanning occur. Black freckles may develop over forehead, face, and shoulders. Bluish-black discoloration may develop around nipples, lips, mouth, rectum, scrotum, or vagina. Patients will notice weight loss, dehydration, poor appetite, muscle aches, nausea and vomiting, and diarrhea, and intolerance to the cold. Unless severe, symptoms only arise when stressed. If not treated, severe abdominal pains, profound weakness, extremely low blood pressure, kidney failure, and shock may occur. May be difficult to diagnose due to slow and subtle symptoms, and because no single lab test may give definitive results in early stages. For management, it must be treated with corticosteroids and IV fluids. Typically, oral corticosteroids can be given, but in severely ill patients, they need IV or IM at first dose. Doses must be given in divided doses, with the biggest one in the AM, because the body normally produces cortisol in the AM. Therapy will be taken daily for the rest of one's life.
So, I know I haven't been here much, but I've been busy with work and stuff, so one more person to do my last section of my chapter.
I am Batman, and I'm here to do hypercholesterolemia. More than 25% of the US population has hypercholesterolemia. It has been linked to early heart disease. Treatment is overall suboptimal. High-fat diet and inactivity combined with susceptible genotype appears to cause hypercholesterolemia. And I am Batman! It does not cause symptoms and cannot be routinely screened for preventative reasons. Suggested that 20 and older should have blood cholesterol level measured at least every 5 years. Risk factors include obesity, diabetes, smokers, or high blood pressure. Signs and symptoms. There are no symptoms, usually discovered during routine screening. So for management, treatment depends on the patient's risks and goals. Basically, you need to exercise and have lifestyle changes, diet changes. If physical activity, low fat and low cholesterol diet doesn't improve lipid levels, a cholesterol lowering medication can be given.